No one would set out to deliberately infect a friend, a loved one, or the local community. But you know, if you don't self-isolate when you have COVID or COVID symptoms, that is exactly what you're doing. The rules are clear and they're made for everyone's benefit. If you're told to self-isolate, whether that's because you've tested positive or you've been in close contact with someone who has the virus, you need to stay at home for 10 days. That means you don't go out for work, to go shopping or for exercise.
There's people that you live with, so you'd be isolating as a case, but also all the people in your household would need to isolate as well. There might be people that you work with that have been in contact with you whilst you've been infectious. They would also need to self-isolate. And there might be people in your childcare or support bubble that also have been in close contact with you, and they need to isolate.
You can get more information from this website. Just search for stay-at-home guidance. Now, if you're told to self-isolate, you may be able to access the Test and Trace Support Payment Scheme, which provides a £500 payment to help during isolation. Again, this website has all the information you need. If you are not eligible for that payment, there are organisations like village agents who can explore what other options are available based on your individual need. The Coronavirus Helpline can give you advice on the support that's available in your area. The line is open from 8 till 6, 7 days a week. Stephen Ward is a volunteer helper in Wellington. He and his fellow volunteers have spent the last year helping people who are either shielding or isolating because of coronavirus, delivering either prescription drugs or shopping.
We're getting a lot of calls from people who have been told to isolate, and if they are, then we're very happy to provide the service. We sometimes get advised by the pharmacy that somebody can't collect, and really that's what we're there for. We're there to go out and help people.
It is everyone's responsibility to help keep the virus under control, to help ensure numbers don't start climbing again.
The more virus that's in circulation, so the higher our rates of transmission, the more chance the virus has during that replication process to create new strains. And those new strains might be harder for us to contain. So what we need to do in Somerset, in our communities, everywhere, is keep the rates as low as possible to minimise the risk of new variants emerging.
So to sum up, you will need to self-isolate if either you've tested positive or you are showing COVID symptoms. You'll also need to self-isolate if you've been in close contact with a case. Now, you may get a phone call, and if you do, that will be from Somerset Public Health staff, or you may get an alert if you're signed up to the NHS app. That will automatically alert you if you've been in close contact with someone who's tested positive for COVID. Either way, make sure you follow the rules for your sake and everyone else's. I'll see you next week.